I just think the trickle down from the top, when there was opportunity to give a really full coverage explanation so that people would not panic, it wasn't given. And that's frustrating.
This is the Biz Reveal, and I am your host, Craig Sawyer. This week's episode of the Biz Reveal is sponsored by Sawyer Health Solutions. When it comes to health coverage for you and your family, one size does not fit all. Customize your health plan to fit your family's specific needs and budget so that you only pay for the benefits you need. Go to SawyerHealthSolutions.com for a free customized quote today, or call 239-677-9877. Sawyer Health Solutions, affordable solutions for your health insurance needs. On episode 12 with Dr. Christine Hoke, we are joined again this week by Dr. Christine Hoke for a one-on-one discussion about the COVID-19 pandemic and how it has affected small businesses in 2020. We also exchanged views on the seemingly contradictory information provided by top government officials and local regulations across America. Dr. Hoke is a graduate of Joliet Junior College, and she received both her BS in Human Biology and her Doctorate of Chiropractic from the National College of Chiropractic in Lombard, Illinois. She also received her graduate and postgraduate certifications in acupuncture from NCC. You can reach Dr. Christine Hoke directly at FortMyersChiroStudio.com. This is the Biz Reveal with this week's guest, Dr. Christine Hoke, and Pondering the Pandemic.
Yes.
Do you have some ways that it affected you?
Yes and no. Yes and no.
Business slowed down, right?
Well, initially it did. I can't remember the date. I think it was right after March 13th that Fort Myers decided to make everybody stay home. Through my next week was pretty unaffected. But then after that, the cancellations came in.
Yeah. And honestly, I think it's just because was it because they started losing their jobs and didn't have money, or was it because they were afraid to go out in public?
Back then, I think it was nobody knew what they were dealing with, and everybody was really scared. And they thought if they're going to do stay home orders nationwide, right. People are going to do what they're told. And so, I lost probably 70% of my business that week and moving on out.
In the first week? So it just dropped.
Yeah, it just dropped. It's like someone turned off a water faucet.
Wow.
Yeah.
Now, mine didn't cut off that quickly. I did notice, though, a pretty straight downward slope. It wasn't just a drop off, but it was a downward slope in people who responded. Like when I'm sending out messages to people, emails, text messages, or making phone calls, the people just weren't responsive like they were before. So they just weren't asking for help.
They're unsure of what's coming, and so they're unsure of what their next step should be.
Just like it always is anytime there's it's an election year. And, in health insurance, I get this every 4 years, is people are like, well, we're kind of waiting to see what happens with the election, as if the very next day, health insurance across the industry is going to change the very next morning. And, of course it doesn't. But anytime there's that uncertainty, people do change their behaviors. And so, mine wasn't a drastic drop off immediately. It has since, but it was a little bit more of a gradual downturn.
For me, people have to show up in my office. And so, they start with the essential versus non-essential and what's what.
Right.
And I guess everybody in their minds thought, well, even though that's healthcare, that's chiropractic, it's not like I run an emergency room or urgent care, that we weren't going to be open. And a lot of people were surprised when we said, no, we're going to be open. In fact, the governor of Florida wants us open because they don't want migraine, back pain people going to the ER because they were afraid there was going to be this, landslide of COVID patients coming into the hospitals. And they didn't want the back pain, migraine, pain population heading to the ER. So they wanted us open, which is great because I wanted to stay open. But if you're staying home, then you're going nowhere. And I'll tell you, driving to work on those mornings, it was like post-apocalyptic. There was nobody on the roads. It was the strangest
kind of
thing.
Nice, but a little freaky.
Spooky.
Yeah.
Very spooky.
Yeah, it was a little different. And being at the time of the year it was down here, I know we have listeners that are going to be all over the country, but down here, we have our in season and out of season. And it was just at that same time that our snowbirds tend to start leaving.
Right.
And I don't know if they were leaving quicker because of being worried if they can go back to their home state or not, they'd be allowed back in.
Some did. Canadians definitely went home early. And some decided we might as well get out while we still can because they saw the stay-at-home orders also as, there's not going to be, if they flew here, they're not going to be able to fly back. And so some people went back early. Others thought, if I have to be locked up, I may as well be locked up in Florida. I've got a nice home here and I can be outside. So a lot of people actually stayed longer. But the effect on me was probably an immediate 70% drop. And then the longer the whole lockdown thing went on, people were just like, this is crazy. Like, I hurt. I need to get in and get my treatment. And then my phone started ringing and they said, are you open? I'm like, we never closed. Come on in.
Yeah. And I think some of the fear started. I mean, you had that first thing, you got this disease or virus that, is going everywhere and it's affecting the entire planet in some fashion. And then you first hear about it. And some people, with reason, get a little spooked out by that and everybody wants to stay indoors and kind of hide. But I think once they realized that it was like a 99.92% chance or something like that you wouldn't get it, and that realization kind of set in. Now, granted,
not that you wouldn't get it, that you wouldn't die from it.
That you wouldn't die from it, right? Yeah. I think it's even less. So that was if you got it, the survival rate, if you actually got it, and then, getting it, I think was an even smaller percentage.
Yeah, it's about that. I don't look at statistics and I don't crawl the CDC website. I've looked at it a few times, but in the grand scheme of things, it's got the virility of a flu and the mortality rate of a flu.
Yeah.
It's in the same ballpark.
But you know what? And you and I agree on a lot of that. Mm-hmm. However, if you're on Facebook and you see all these other arguments, some are just insane. However, some of them do have some merit. I'll give them that. And, one person posted on there to kind of keep things in perspective was, if you knew that, your next alcoholic drink, you had a 1 in 1,000 chance of it killing you, would you drink that drink? 1 in 1,000. I mean, that's a pretty small odds.
What are the stats on car wrecks? You're in the insurance industry. I mean,
not car insurance.
Oh, that's true. But, what are your chances of getting into a fatal car accident on a day-to-day basis?
And we still get in the car and go places.
Several times a day, apparently.
All right, well, here's the other. Again, I'm going to play devil's advocate again, but you may feel safe. You may want to take that risk. And this is that to mask or not to mask, right? Mm. And fine, you feel safe, but if you're out and about, you want to make sure that you're not giving it to somebody else just in case you do have it and don't know you don't have it. So I get that respect part of it. However, if they're wearing a mask,
you shouldn't have anything to worry about.
You know what I mean? So there's that. And again, I'm not a medical doctor or anything, so I can't say how it spreads, how it doesn't spread. In fact, even the experts aren't exactly sure on that because what they told us in March, April, May completely reversed in June, July, and August. So
well, still, one of the number one infectious diseases in the world right now is tuberculosis. Kills 1.5 million people a year.
And again, another breathing disease, right?
And you know what? I once upon a time was in nursing. We did not mask up before we went into those rooms with those patients that we knew had TB. They would just say, you're healthy. Have you had your TB test to make sure that you're healthy and you're not susceptible? Yes. Then you're going in.
Right.
You're fine. And we can treat you if you get it. Which I feel the same way about this. So. Well,
and going along that, how about, and again, I'm just talking about the contradictory advice that we've been given. If you have a mask on, why have the 6-foot rule? If the 6-foot rule works, then do I need a mask? If the mask works, do I need to be 6 feet away from you? Or are they just trying to say, well, you know what, better safe than sorry, double up. It never hurts to, to do both. I guess it's like the airbag and the seatbelt argument, right? If one or the other one's going to save your life, why do they have both? Well, I guess your chances are even better.
Initially, I don't think it was both. It was if you can't stay 6 feet away, make sure you wear a mask.
Initially,
It was one or the other. And I don't know where it took a turn. Honestly, I think the media and the public at large is what made it what it is. I know that the people at the top, we'll name names, Fauci, let's name names. He's been the master of confusion up there. There's no doubt he's an educated man. There's no doubt that his credentials speak. He's not treating patients, but he is an expert in the field of virology and epidemiology. However, every time he had a press conference and would talk about something, let's say, for instance, the bit about whether or not we'll have immunity once we've been exposed and been sick, we're not producing antibodies. He gets on this press conference and he talks about how not everybody's going to produce antibodies. And it's left hanging there. So the press is asking questions, but he doesn't continue.
There's no definitive answer.
Well, he doesn't continue. The rest of that conversation is, we don't always produce antibodies. Oh, that's because we also have T-cell mediated immunity. And when your body comes in contact with something and your T-cells react, it's like flaking a flea.
Yeah.
Oh, you're nothing. Boop, T-cell took care of it. You now have immunity. And there was no need for the big cascade of the immune complex to happen and for you to produce the IgM and IgG antibodies. That's the only reason you wouldn't, is because the T-cell mediation took care of it.
Okay.
Had he finished that sentence during that interview, there wouldn't have been all this craziness about, well, we don't know if we're going to have immunity about it. Of course you are. That's the way the human body works, and that's how immunology works. It hasn't changed.
And with the lack of an answer,
it's left to the
people are going to come up with their own, or at least, their minds are going to start wandering. And then that's where you get all the misinformation and the scaring of, people get frightened by the unknown, right? I mean, that's just human nature. If you don't know, it scares you. And
I was super frustrated. I'm no virologist. I'm no immunologist, but every MD, DO, DC, nurse practitioner, everybody in health they've got a, doctorate degree. They've studied microbiology. That's every bug that we're aware of.
Right.
What it looks like under the microscope, how it affects you physically, how do you treat it, what are the things to do. I don't ever remember in microbiology class, and my microbiology teacher was a germaphobe. I don't ever remember her talking about staying 6 feet from anybody or putting a mask on for any of this stuff.
Right.
And there's some scarier things today than when I was in college, like MRSA, antibiotic-resistant staph infections. Those are the scary things that you can't kill. So, I don't know. I just think the trickle down from the top, when there was opportunity to give a really full coverage explanation, so that people would not panic, it wasn't given.
Right.
And that's frustrating. And then me, who threw out all of my textbooks, I'm like searching the web for just the basics of immunology. You can't find what you're looking for when you want to. I was just dying to have a textbook so I could take pictures of the pages. But of course, the libraries were closed.
Well, and then they also have, and one thing too about the day and age of the internet, you can go back and look at old video clips and old interviews for past viruses like this, and the advice that was given by the same people, namely Dr. Fauci, was the complete 180 as what it is now. And I think that now you're talking about a mistrust, because if they're saying one thing for one disease and then they're saying something that's similar, right? Because we had SARS, what was that, back in 2012, I believe, which killed a heck of a lot more people. A lot more people were infected, killed a lot more people. The percentage was a lot greater, and the opportunity of getting it was a lot greater than this. But the treatment should be very similar, if not the same. Yeah. And what he recommended then, he does not recommend now. Namely that, what is that?
Hydrochloroquine.
Yeah. He recommended it, and then they're like, oh, no, that's insane. And of course, you can go on all kinds of conspiracy theories or political issues with that. Being in my line of work in health insurance, that is a tremendously cheap drug. And the drugs that they're recommending are tremendously expensive drugs.
Yeah, remdesivir.
Is there something behind that? Maybe.
Remdesivir, I think the last I heard, it was $3,000 a dose. Whose name's on that patent? Oh, let me think. Fauci's name is on that patent.
Crazy. So, yeah, I do think, obviously this is a worldwide issue. It's not just an American issue. So the argument of it being political type deal? Maybe not, but it is, some of the coincidences are strange. I'll put it that way. I'm not going to say one side or the other. However, it is odd that it is a man-made virus. That's proven. It's also proven that it came from that Wuhan laboratory.
Yep. That's
proven. It's also proven that former President Obama, had given them, I'm not sure what the exact amount was, in the billions, just prior to him getting out of office. Like literally, I think it was within days, I believe.
Yes.
Days or weeks. Had provided funds to that specific laboratory. And then obviously the timing of it is, again, a little bit coincidental that immediately, I think it was within 2 or 3 days of the impeachment thing going, basically nothing happened there. And then 2 or 3 days later, all of a sudden now this thing comes up out of that laboratory. It just seems very coincidental to be explained in any other way.
When it was funny when all this started, I remember reading, I get some medical journals. Now they're online. You don't get a stack of medical journals mailed to you anymore.
Right.
And I subscribe to a few different ones. And no matter what you subscribe to, there's always something else. Hey, have you read this article in Microbiology Today?
Right.
And I had read an article. I think it was my American Journal of Microbiology. It was something to that nature. I couldn't remember because I read the article and I was just like, well, that's interesting. And it was actually about a virus originating in Wuhan, and that somehow this had gotten out of the lab in one way, shape, or form, and that it was causing all of these problems. And I think I read that in December. Pretty sure I read that in December. And I remember coming back from vacation, and we had, New Year's, and then we're heading into the 1st of February, and that's when the news starts to kind of hit about this stuff. And I'm like, I read an article about that. Gosh, if that's man-made in a laboratory, that could be a bioweapon. Ugh, I really wish I remember. So then I start searching for it. I can't find it anywhere. I go to American Journal of Microbiology, or whichever journal it was, and I'm looking. There's articles there from November, none from December. There's some from January and February. It's ironic. Ironically, the December issue is not there. So now I think that's funny. And the more you Google something, the more stuff comes up. And so all I got really on my searches was a backlash about, no, this is not a man-made thing that came, that's false news. That's whatever. Right. And here we are how many months later, and no, that's exactly what happened.
I wish I had the lady's name. But she's the one she's the professional at the Wuhan laboratory for diseases that are carried by bats. Like that's what her lifetime has been about. And there is a sequence of events that happened up to the first case in Wuhan, because originally they said it was coming from that market.
Yeah.
Right. Yeah. That there was a bat that was
Chinese
sold.
Chinese people have been eating food like that for centuries.
Right.
It would have come along before today.
Apparently that market is 2 miles away from that laboratory.
Yes.
So they had it pinpointed pretty darn close. But they believe, and apparently when there's been inspections done at this Wuhan laboratory, that, it's a very dirty place, that they, a lot of cross-contamination with these different experiments and things like that. So it is very likely, and this is what is assumed, and with very strong evidence to back it up, is that when conducting these experiments on these coronaviruses that are carried by bats, that it was just basically transferred to a person, and then that person left the lab and went somewhere else, and it just kind of went from there. So it wasn't that somebody ate a bat in a market.
No.
It was carried out in other ways. And that lady, who's world renowned for her research, like she is really knows her stuff. She's nowhere to be found now.
Nobody can find her.
Yeah. There's just so many coincidences. And for it to have affected the world the way it has, not just America, not just small businesses, but it's affected everybody. Like countries are on lockdown. The world economy, took a tank, and people are scared. So it's obviously going to change our outlook on things going forward. So, and that was another thing I wanted to talk about too, is when this does blow over, dare I say, the morning of November 4th, But when this does finally blow over, whether it's next week, next month, next year, whenever it may be, how's the world going to look? How are we doing business differently? Because now, when you go into restaurants, just so that they don't have to do the 6 feet apart thing, you can see the clear plexiglass dividers in between booths, right? And I like that they're plexiglass because it feels like it's still open, even though it's not. So if you're going to do it, I think that's a cool way so you don't feel really enclosed in a little box. Will those things stay? I would assume so. I think that there's going to be, take stock in plexiglass, right?
I really hope not. Your immune system, you have to challenge your immune system. It's not going to get strong unchallenged any more than a weightlifter is going to get strong if he doesn't challenge with weights.
Right.
You have to be exposed to things in order to build immunity to a variety of things. You're in contact with 300 million microbes on any given day throughout your life, every day throughout your lifetime. And how your body responds to all of things is what builds this microbiome and the response that you have. And that's partially why you can have T-cell mediated immunity, because your immune system's working so well, there's just no need essentially to turn on the whole system in order to get over this.
Your body's made to kick that stuff out.
Yes. But you have to be exposed to it.
Right. If everything's hygienic, if you're, doing sanitizer all the time, you're not going outside, you're not touching things. Our generation, I hate saying that, but our generation, we ate dirt.
We did. We totally did.
We ate dirt. We ate paste out of the little thing in kindergarten. We drank out of the garden hose. We can tell those stories, the going uphill both ways to school.
How many times did, a woman with a baby, I know my mother did it. The baby drops the pacifier, picks it up off the ground, licks it, puts it back in the baby's mouth.
But now we're sanitizing everything so that one small germ you come in contact with is going to make you sick.
Yeah,
and you're not building an immunity. And my wife is experiencing this because, she's a teacher. She went back to school yesterday. And this hasn't been a big topic in our household. It has kind of changed how I'm viewing the whole situation with coronavirus because of this situation. She's going to go back into a classroom where you're in a confined space. There is no, you have the air conditioners, but other than that, there's no circulation of air. It's not like you can have the windows open down here when it's 95 degrees outside. No. So you are in a confined space, or the school buses.
Yeah.
They can't keep 6 feet apart in a school bus. It's not possible. So you have to keep them 6 foot apart in the classroom, but they're sitting next to each other on the school bus without that. And what happens in between classes? You got 3 or 4 minutes there where they're all going to be playing with each other. You can't, it's not possible.
You hope that they're going to be playing with each other, because some of the scenarios that I've been reading about what's going to happen, these poor children, neurologic development happens at play. It happens when you're discovering your environment. Your immunity gets a workout when you're discovering your environment. And if that is all taken away from kids, I'm fearful for their neurologic development. I'm fearful for their immunologic development. I'm fearful for their social development. How do you learn to share and to get along if you're in isolation? You stay in your square, I'll stay in mine.
And depression. There's going to be, and I know that's a topic right now, and I know that's the push to get students back in school. It's not just about moving on, because there is a risk. And I don't think that they're saying that there's not a risk. I just think that they're saying that the risk of getting coronavirus is so much less than the risk of not going back to school and having the mental issues that it may cause, the depression, the isolation. Humans are made to interact.
We are.
And that's why you have the horrible stories of, solitary confinement, in prisons or in the military. Your mind does very bad things to you when you're by yourself.
Yes.
And if you're somebody who's already battling depression, it just got 10 times worse. Or if you're somebody who has been seeking treatment for depression or treatment for PTSD, and now you can't go to those types of counseling appointments because of the restrictions, now you're by yourself, and that is a horrible thing. And there's only so much you can do with technology and little virtual meetings and things like that. But human interaction, whether it be conversating and communicating vocally like we are right now, but physical touch.
Yeah.
How good does it feel to hug somebody? It always makes you feel better, right?
It does.
And
And it's good for you.
How long
you release
has it been?
oxytocin. It's
Right.
physically good for you.
How long has it been? And even doing business, I've had a lot of meetings with people, whether it be my own customers or I'm a customer going somewhere else and finishing that deal and you don't do the handshake. It just doesn't feel right. It's just not natural. So how do we get past that in the future? Are we going to stop touching each other because, you remember coronavirus back in 2020, and here we are 5 years later and we're still not doing those types of things. What does it mean for us?
I wrote something the other day. A friend of mine asked a question about what's the end game with this. And I said, I think we've just gone back 100 years where health and medicine is concerned. And she said, what do you mean? I said, if you look at old medical texts, let's go back 100 years, more than 100 years. For everyone gets sick, are we now going to bloodlet them to let out the evil humors? Is that how we're going to cure people now? I mean, the mask, the social distancing, and some of the really kind of insane procedurals that have come up. I mean, I'm no surgeon. Surgeons are trained, when they put gloves on and masks on, they're trained not to touch things. And it takes some time to learn not to touch things. The rest of us don't live that way. It's very difficult.
It's so hard.
And you're never going to, I'm like, at least I'm in medicine and at least I understand the concept of it and I could do it if I had to. But the average person is A, not going to be able to do it, and B, nor should they. Nor should they be doing this. I just feel like it's a new development of old wives' tales. Kind of like the concept, let's rub, if someone has a high fever, back in the early 1800s, they had a high fever, let's rub their feet to draw the fever from their head. I'm sorry, that's not how that works. And you know what? You being 6 feet from me does nothing for you either. I don't know where it comes from and I don't know why. I read something that the whole 6 feet thing came from some high school student who wrote a paper.
I heard that as well. I don't know.
And I think if this is where this concept came from, they should all be fired.
Right. Yeah. Out of all the people who have spent hundreds of thousands of dollars on education and getting degrees and PhDs, and then we're all living by something that a high school student had mentioned.
And I'm not concerned about students at school. Yes, if you've been isolating, the chances that you're going to react to something in your environment, whether it's the millions of colds that are out there, the flu, pneumonia, whatever it is, you are going to react to it because you haven't been exposed to it. You haven't been challenging that immune system. Right. So, they say, well, when we open up, there could be there's going to be a surge. There's going to be, but it's not going to be what they're predicting. I don't think it's going to be what they think. And as far as the whole, you're going to kill your grandmother thing, I was just, my mom was immune compromised. She had leukemia. We all knew as young adults and adults, if we weren't feeling well, we weren't going to visit my mother. We'd call her on the phone instead. We just knew that she couldn't tolerate it. She couldn't handle it. And so we didn't all isolate ourselves, but we just didn't go visit my mom that week. Wait until you're over it and then go visit mom.
Right. Isolate the people who have.
Yeah, it makes common sense to do that. Right. If her body can't tolerate that sort of thing, then we're going to protect her in that way. And the way it flies around the media, it's like it's some brand new concept that nobody, where's this? I don't know. I kind of grew up this way. If you're sick, don't visit grandma. That was the way we lived our lives.
But is it also because, things are so, the cities are bigger. We're more compact. Actually, I say that. But then again, you can look back in the early 1900s, over 100 years ago, and you look at New York City, it was probably even as busy, if not busier on the street than it is now. And certainly it wasn't nearly as hygienic back then, with the horses and selling and we didn't open on the streets and things like that. And the way
sewage was handled back then.
Oh, sure.
Yeah, there were all kinds of problems.
No, then again, there were also a lot more diseases back then. But we also did not have the medical technology and didn't know how to treat a lot of them back then either. So
the Industrial Revolution changed everything. Clean water changed everything.
Yeah, plumbing.
Yeah, plumbing changed everything.
Plumbing. And I know when I was kind of looking at some of the things online about the types of businesses that were most affected. And and I hate using the term. In fact, I don't use it. I'm using it because they're using it here, is the non-essential.
Oh, yeah.
I hate saying non-essential because if you're somebody who works in that field, it's essential to you.
If you're providing food and shelter for your family, you're essential.
It's essential. It's essential that you continue to work for you to live. But what they're saying 100% of the personal services industry, which includes beauty, which would be like hair salons and things like that, pet care and dry cleaning, 100% of them are likely to report negative impact from COVID-19. So every one of them, and I'm assuming that's because of the shutdowns.
Yeah.
I mean, they were forced to close.
Right.
And I understand, that's the industries where you're touching things, that you have direct contact with people. You can't cut somebody's hair and not have contact with them. So again, going back to our conversation before, right or wrong, but they were shut down. Obviously, that would create a problem with 100% of them. But the next two were hospitality, which is in lodging, travel, transportation, casinos. Again, people stopped traveling. That kind of makes sense. That was 95%. And then 90% for manufacturing. That one there kind of surprises me. Why manufacturing would be an industry that would be so heavily affected? They're like number 3 on here.
Probably just the fact that they were stay-home orders, so people would stay home. You're not going to run your factory with a skeleton crew.
I do remember a news story about the manufacturers that was spreading really fast there. Is that because maybe the assembly lines and people working so closely together? Well, and I remember that being a thing. And I think that was in March.
I'm curious about the spreading, though, because there's a lot of semantics going on when you're talking about cases. Cases, as far as the CDC is concerned, is a positive test result. That doesn't mean you have symptoms. It doesn't mean you're sick. It doesn't mean you have a disease. I don't know where in our history we've ever made people stay home from work because they had a positive test case without medicine just isn't done that way. You don't go, if you come in,
especially on a large scale.
Yeah. When you come into the ER and you've been in a car accident and you've got a head wound, the first thing the ER doctors are not concerned with is infectious disease. They're the ER. They always are gloved up and whatever. That's how they do their work. But they're worried about stabilizing the patient. And for the first time, it just seemed like getting that COVID test became a priority. And I think that's because of the money. The federal government was handing over to hospitals for every positive COVID test, $13,000. If that same patient then went on to a ventilator, they got $39,000.
They're incentivizing diagnosis. And that is the quickest and easiest way to get corrupt.
Yeah, absolutely.
Absolutely corrupt.
Absolutely. So here's this person who's been in a car accident, for example. They test positive. They get their $13,000. But then they're this man who should be the last place you want to stay if you're healthy is a hospital.
Right. That's the quickest way to get disease.
You want to go home if you're well enough. So treat his wounds, whatever they were, and send him home. Well, they won't send him home because he had a positive COVID test without any symptoms whatsoever. I don't know.
Well, and to go along with that, and I know, again, we're talking about a lot of this stuff. This is going to be controversial just because so many different people disagree or agree with different things, and there's so many different things out there. And I'm okay with that because we're not saying one way is right or wrong. We're just giving our opinions here. But you also have the fact, and again, proven, this has been stated publicly by public officials, that no matter how you died, no matter the cause of death, if you had COVID at the time that you died.
If you had a positive test.
Correct.
Yeah.
If you have had a positive test, it's listed as a COVID death, which makes, again, the statistics so slanted. And so you could have died in a car accident, right? If you got diagnosed yesterday with a positive test, again, no symptoms.
And they were doing tests post-mortem on people too.
And again, if you're getting incentivized to give positive results, how much faith can you put into the results?
Well, I'll tell you, not a whole lot, because the swab antigen test that they have been using from Go, it's funny because I think that's manufactured by a company that's owned by Pritzker. Pritzker is the governor of Illinois. It says if you get your hands on or look it up, get your hands on one of those tests, it says on the test kit, there's always literature with tests about effectiveness and accuracy. It says that this test is not specific for COVID-19. It's a coronavirus test. Well, coronaviruses, that's the common cold. Your dogs and cats get coronavirus, and coronaviruses mutate. They transmit quickly and they mutate quickly. That's the interesting thing about coronavirus. And so the test kit says this is not specific for COVID-19. So what does a positive test actually mean? It doesn't mean you have COVID-19.
To me, it's kind of like a pregnancy test. If you think you're pregnant, you take one of them. But do you rely on that? No. If it comes out positive, then you go to the doctor and get a reliable test.
But there's no ladder. There's no step up to go confirm. And in medicine, you have other tests like that. If you run kind of a screening test for some kind of disease and you get a positive, it leads you to the next step to get something more specific. But you've also got the patient's signs and symptoms to correlate. You're hunting. There's something wrong with this person and you're trying to find the answer. With the COVID thing, nobody's hunting for anything. They're just trying to get a positive test result in order to be paid. I don't really understand. Well, that rabbit hole is deep.
Yeah, it is. It is. And I don't think it'll be the end of it.
No.
At least I hope not. I hope it's not the end of it, because when this does go away, it'll go away at some point.
I think we're going to live here symbiotically with it. It's going to be here like everything else.
But if it's a moneymaker for certain groups of people or certain industries or, politicians or whatever the case is, then it just means that there's going to be another one, because it shuts down one part so you can use it as a political tool. Because if you want to make a political opponent look bad, the economy tanking is the best way to do it. It really is the best way to do it. And then, so now you have a worldwide way of tanking the world economy, or, you can make it a certain area. But if you're incentivizing people to come up with, for every positive, look, not everybody's honest in the world, right? We all know that. It makes you lose faith in the medical industry, because just the possibility that they're going to diagnose you. You don't even have to be
dishonest, though. This test has a 60% false positive rate. Yeah. You don't even have to be dishonest.
No. And there's so many ways that you can make a positive that's not a positive. Yeah. It just depends on how you explain. It could be literally positive. You can say, yeah, it's positive, but either one, it's not accurate, or it's positive for a coronavirus, not necessarily COVID-19.
And if the person is not suffering with signs and symptoms of that disease, what does it really mean?
Right. It just means you have it, but we have a lot of stuff that don't.
Well, staph. That's the simplest thing. Staphylococcus aureus. Pardon my pronunciation. Yeah, Staphylococcus aureus. I'm not even pronouncing it correctly. It lives on your skin. So if you and I decided to take a swab of our skin, just scrape a few skin cells with just a brush and look at them under the microscope, or test somehow, do a gram stain test for the staph, it would be there. Neither one of us have a skin disease and neither one of us are sick. It lives here always on the host.
Why are we treating this particular
different than that?
Yeah,
exactly. Because you don't go
out of all the other viruses,
strep and staph testing everybody who walks in with the sniffles. You just don't.
Right.
So, part of it too is, again, that rabbit hole is deep, but Agenda 2021, and some places Agenda 2030, that's the World Health Organization. And they have a committee called Agenda 2021, and it was about a worldwide case scenario of a pandemic and what the steps would be. It's a long document. It's a published document, and you can pull it up and you can read it. It's real. That's not a conspiracy theory. That's a real thing that heads of state from all of the countries who belong in the UN are part of. And can't help but wonder if this is not that test. It was supposed to be a testing scenario. I can't help but wonder if this is just a testing scenario. It would be easy to have, now this gets crazy because you can think I'm crazy, but I think it would be easy to take someone who walks into the hospital with pneumonia and call it whatever you want to call it. Does that person know? They're not going to know any different. And when your CDC, through your departments of health, down to your hospital admins, start dictating how you care for people, those doctors were not allowed to use their expertise and training to treat those patients, especially the public hospitals in the bigger cities. New York would be that.
So the protocol was changed.
There was a protocol. This is what you're going to do. If they're not sick enough, send them home. Tell them to come back when they're sick enough. Okay, when's the last time you went to the doctor and you were sick and he said, go home until it gets bad?
Right.
That doesn't happen.
Right.
Why did it happen this time? Because in the early stages, you could have treated these people and they would have been fine, just like anything else.
And where does the fault lie in there? Because again, there's an argument there. And
I think it starts at the top.
Being a political year, right? I mean, you're going to hear all kinds of arguments, and I'm not going one side or the other. I'm legitimately asking your opinion on this. Yeah. Where did that directive come from? Did it come from the president of the United States? Did it come from somebody like Dr. Fauci in that type of position?
Well, that was his job.
Okay.
That has been his job for 37 years, to manage infectious disease.
So then we have to ask ourselves, why was the directive, again, why was this particular case treated so much differently than similar viruses or diseases? Why was it treated so much differently when the virus itself it's not really all that different?
Right. There's a lot of things. Initially, early on, ask myself these questions every day. Early on, I would think, well, if this was developed in a lab and it was meant to be a bioweapon, maybe they're unsure of how it's going to react in the general public. Maybe that's why all the caution. And then as time goes on, you're like, oh, wait a minute. Now there's incentives. There's money. There's incentives, and they're using faulty testing. Oh, this is not good. Oh, now there's a protocol for how to treat people. So many doctors have spoken out about, like, we are not allowed to use our good sense and our skills to treat our patients. We were told we had to do this, and there is a
protocol. There's a protocol in place for these types of things. There's protocols in place for bioweapons. I mean, it's not like America. I mean, the United States is not unprepared.
Right.
We are prepared for more things than you and I could even dream up that even exist. And they're prepared. They have protocols for all kinds of stuff. You're going to tell me something like this with the 99 point whatever percent survival rate, and it is not going to have some type of protocol. Like, this has never happened before. What was the excuse me, if even after the 2012 SARS incident, and there's been other ones prior to that.
Sure.
But let's just say that one. Of course, after that happened, somebody would be like, ding, ding, if this should ever happen again, we need to make sure we have a protocol. So don't tell me that there was no protocol, and for some reason this particular case had to be different than past cases or future cases that are going to happen. And if indeed it was some type of bioweapon test, that leads to a whole that is a deep rabbit hole, because that's illegal.
Yeah.
The laws of war and the Geneva Convention and everything.
Yes.
So, which doesn't, which again, does that mean anything? So, you can go down that hole too, but it is strange to me why is this such an anomaly? Like, it's so special, and it's really not.
And all of the really controversial stuff, really, the social media blackout of that stuff has been incredible.
Yeah.
Personal friends of mine from across the U.S., especially in California, where I know a number of chiropractors, know a number of MDs in California, who got on the panel at the courthouse and gave a speech. Everybody saw it for a minute before it was yanked. But these people are trying to be heard, and they're not alone. Maybe they're willing to speak out. Maybe they're ultra patriotic, or maybe financially they're in a place where if they get fired, which they probably all have been, I know at least one of them has, or two of them have, that they're going to be okay with whatever they're doing. But this idea that MDs are super wealthy people, it isn't true. They've got student loans and they've got a mortgage and they've got kids to put through college and they have things too. And where else are they going to work if they don't want to be in private practice? So to lose their job at the hospital would be tragic for their family. So they kind of, don't rock the boat, don't say anything, just go along. And then we had that undercover footage from that one nurse who was working in a public hospital in New York, and she was talking about people that were seemingly healthy, that had a bit of a cold, came in, they tested positive, they stick them in a room, and then someone else comes in and essentially scares them into accepting the idea that they have to go on a ventilator. Well, I've never worked with a ventilator and I've never practiced medicine in that way. That's not what I do. But you learn enough in school, you know enough to know better that you don't vent people unless it's necessary, because there's inherent risks to being ventilated, including embolus, which is what was happening with some people. They were having embolus. And then to stay sedated, because you can't just trach someone. They're going to fight it the whole way. You have to sedate them. Well, anywhere up to like 10 or 13 drugs are being used to sedate people. You don't think being drugged out of your mind, laying in a bed and not moving, hooked up to a ventilator, isn't going to create some problems with blood clots? Of course it will.
Yeah.
Now, they've also come out and talked about how this particular virus was creating blood clots someplace. I'm like, okay, were they?
Was it the virus or was it the treatment?
Well, yeah, was it? Has anybody parsed that out to see what the real deal is?
Right.
I'm not sure.
And again,
they're not telling me.
I don't think either one of us are saying this isn't real. It's certainly a real thing. And I have a relative, just north of us, a couple hours north of us, who works in an ER. Actually, I believe she works in the ER, but at a hospital, and she sees these cases firsthand. And she has expressed the emotional toll that it has taken on her, because they are losing people. Mm-hmm. At least they're losing people at a higher rate than prior to coronavirus. What the extreme is, I'm not there. I just go off of what she told me. So it is real. It does exist.
Sure.
I think the thing that you and I are discussing is just the inconsistencies of the diagnosis, the information that's provided. Some of the things just don't make sense, don't add up. So we're just talking about those things. So I don't want anybody who's listening to this to think that we're saying that it's a hoax and none of it's real.
No.
I think we both are in agreement that it is a real thing. It is a real disease. I think we're just questioning the means in which we are being told to handle it, to cure it, to prevent the spread of it.
Yes.
There's just too many inconsistencies, and it makes one wonder. And when there's so many lives at stake, and not lives at stake of getting the disease and potentially dying from it,
but mental health and social development, all of that.
Economical, the businesses that are forced to close down, which of course is what the podcast is about, is business. And if you're forced to close what you've been working your life to build, and then now you're closed down for 3, 4, 5, 6 months.
Even businesses who've done everything that they could to comply with the best advice that the CDC could give them and has been giving them about, I hate the word social distancing and masks. Even those businesses who have done everything that they possibly could to comply, if just go across the state to Broward County, some businesses still are not allowed to be open.
Right.
They're willing because they need to earn their keep. They're willing to do whatever's should be done. Or, what's the gym? Is it New Jersey? The gym owner, he says, I'm complying in every way, and opened his gym, and a patron, I think, was walking out of the gym. Someone would have to check me on the story, walking out of the gym and didn't have their mask on. And so he was arrested for not enforcing. And I'm just like, well, wait a minute. I can go into the grocery store without a mask, and nobody's going to arrest the owner of the grocery store.
Again, inconsistent.
Yeah.
And again, we're going to end this here in just a moment, but talking about the inconsistencies, they've been letting people out of jail.
Yes.
To prevent the spread of COVID.
Give them a mask if it works.
If you don't wear it, right? But if you don't wear a mask, they're going to arrest you and put you in jail. So they're letting people out of jails because, the overcrowding and keeping people in confined spaces. So let the criminals back out, even though it's lesser criminals. These aren't murderers and rapists, of course, but, it's just the smaller deals. But they're letting people out of prison, but forcing children and teachers back into the classroom. Again, the inconsistencies. And, we got to get the kids back because, again, we talked earlier about the need for social interaction and things like that and keeping the learning going. So I get the need for it. But again, it's that double standard of how are we supposed to accept that when you're letting people out of jail because of the close quarters that they're in, but yet we're sticking kids on school buses.
I don't know
and
that
confining
there's
them in classrooms.
Ever a good reason to let people out of prison for that.
Not when it's not offense related.
At least they are already isolated amongst themselves and their own population.
Right.
So I can't wrap my head around most of it.
Again, there's just too many inconsistencies and the lack of common sense. And again, I don't think either one of us are trying to imply that we have any type of medical degree whatsoever. No. I know you.
I'm a chiropractor, right. But I have not worked in infectious disease. I definitely haven't. We've all learned about it. It's all part of the curriculum going through school. Everybody, it doesn't make us a virologist, an epidemiologist, but you don't need to be to treat people and see how it works. Anyways, but yeah, it's a real thing. People got sick. People died. I think the overreaction, like a big allergy attack, the overreaction and some of the medical protocols and plenty of doctors are talking about the inane medical protocols and
isolating people who don't even have it.
And isolating people and the whole closure of schools that probably should have never happened. Look at Sweden, Right. They're doing good. I just think it was handled wrong. And I just can't, at the back of my head, it just keeps that Agenda 2020, was this a planned thing to see how we'd all react?
And I think we've learned that we're a little too easily controllable.
Maybe. Some of us are.
Yeah. Yeah. All right. Well, Christine, thank you so much.
Thank you.
Loved having you on. Hope everybody else enjoyed this week's episode. Please join us again next week. We're going to have some more conversations that I hope everybody will enjoy. This has been The Biz Reveal. You can see us at thebizreveal.com on the website. You can see all of our past episodes there. Also, check out our YouTube page, like and subscribe, please, to see all the video versions of the podcast. And we will, of course, be on all of your podcast apps. Apple Podcasts, Stitcher, you name it, we're on all of them. Choose your favorite one and we'll be there. Till next time.